Um, so first I wanted to introduce everybody to the newborn survival tips. We've got Dr. Sharon Somek with us today, and we're really excited to talk to you about several tips that I'm sure you guys have lots of questions about. If you guys want to go ahead and start submitting your questions, you guys can do that right now. And if you guys are listening to the recording, you guys are welcome to submit questions to us at any time. Contact Sharon anytime, and she is obviously an expert in the field and happy to get back to you. We also will be sending out the recording via email, and you guys can always find this online or on our YouTube channel as well. So first I am going to talk about the mommy wrap really quick, and then I'll turn it over to Sharon. So my name's Kim Taylor, and I invented the mommy wrap basically because I had 3 colic babies. And what it is a patent pending cardigan that is basically a sweater you're already wearing that can help hold your baby. So some of the benefits from it is that if you have a baby that's suffering from acid reflux or GERD or colic, or you simply like to baby wear or hold your babies, it helps keep them upright and it helps support in that area. It also has convenient connectors for like pacifier clips and teethers, and it has pockets in the front and in the back for all those things that you need. So there are other benefits from it. You can wear your baby in several different ways with the mommy wrap, so it's not just for newborns, but also moms also like to wear it even without baby, especially if you have more than one kid, just to carry all those things that moms need in those pockets. So I'm going to introduce you guys to Dr. Sharon Somek, and Sharon and I have become friends over the past year, and I'm just really excited that we've been launching our businesses together. And I wish that you were around, Sharon, when I had newborns, because I know that I definitely could have used you then. But I'll let you talk a little bit about Raisology, and then we can move on to our survival tips.
Sure. Thanks for the introduction. So I'm Sharon Somek. I'm a pediatrician. I have 4 daughters. My youngest is 3 and my oldest is 12. I'm a New Yorker at heart, and I did spend a good chunk of my life in upstate New York training and going to school, but we're back in New York now, living on Long Island. And I was really fortunate in my years of practice to have worked in young practices, meaning that the practices I worked for had only been 3 to 5 years old when I started. And so my practice has always been very, very newborn and toddler heavy. And the more during that time, I was inspired to become a lactation consultant, and I really gained a lot of experience working with parents of newborns primarily. And I found that unfortunately, there's so much newborn anxiety out there, and I completely can understand, having had 4 kids of my own at different stages of my life, how that happens and why that is. But it was something that made me really sad to see, because what happens often is parents, especially moms, are feeling so anxious in that beginning stage of becoming a mom, and they are often not able to enjoy their babies the way that they want to. And by the time they feel more calm and confident, often they're returning to work and they don't have the time anymore to enjoy their baby the way they want to, or they start worrying about the next phase. And so I'm really excited to have started Raisology really as a way to offer the one-on-one coaching and support that I was not able to really effectively offer in the office due to lack of time, where I work with parents one-on-one from the first, moments really towards the end of the pregnancy, helping them prepare for babies, and then coaching them through that first couple of months of life so that they can feel more calm and confident in their parenting.
Excellent.
So today we're going to talk a little bit about hospital prep and what you can do to make your hospital stay a little bit more pleasant and less stressful. Some tips for caring for yourself. I find that one of the most important things that we neglect when we have a baby is that we remember that the baby is a new patient and a new baby, but we forget about ourselves. And then, of course, tips for caring for your baby and the signs that you might need to call your pediatrician.
Awesome.
So how do you prepare for your hospital stay? I mean, everybody tells you you need to have a hospital bag ready, and you may or may not really have it ready depending on how much sooner you go than you think you're going to go. But for me, what I wanted in that hospital bag was really this stuff that was going to make me feel more like a person and less like a patient when I was there. Because remember, for most of us, we go to the hospital to have a baby. We're not feeling sick. We want a pleasant experience. We want and most of what I'm going to talk about is sort of after the actual birth of the baby, because before the birth of the baby, you're going to do, you're going to have planned whatever is good for you. After the birth of this baby, you want to feel like you are a person again. You're going to take pictures. You want really comfortable PJs. I will say that you are going to have to get checked a lot while you're at the hospital. And so I wore like a nightgown actually, and it was really helpful because it was something I didn't have to take off when nurses would come and check me, but I also didn't have to wear a hospital gown. And I just made sure that it was something that was stretchy and flexible at the top, or a button down one would be great so that you can nurse the baby and you really don't have to change at all. Bring a pillow if you feel strongly that you can't sleep with someone else's pillow and it's more comfortable for you. Slippers or socks, or those comfy socks that are really thick and fun to wear in the winter time. Bring anything that's going to make you feel more like yourself. So, honestly, I brought a hairdryer every time I delivered, and the morning after, I always took a shower and blow dried my hair. And some people will say, like, really, you blow dried your hair? You're in the hospital having a baby. And that's what made me feel more like me. And I needed that because otherwise, you feel like you're in the hospital. and this is a very happy occasion, the happiest occasion you're going to experience in your life. So you should feel good about yourself. And I don't wear makeup on an everyday basis. I'm not wearing any makeup right now, but I wore makeup when after I delivered my kids, and it was fine. I always made sure I got a manicure and pedicure, if I could the week before. And those are things that make me feel good and make me feel more put together and like I really want, like, my best self, I would say, right? Certainly you want to bring your phone charger and all that, especially these days. You're going to be probably texting like crazy and posting things on social media. But food is one of those really important things to me. I love food, and I felt like every time I went in, you go in to have a baby, you may not know this, but when you go in to have a baby, often they don't really let you eat much because they're worried in the event that you're going to need to go through a C-section, or in the event that they're going to need to do something that would be better if you didn't eat. They don't really let you eat once you show up. So I always made sure to have my list of things that I want my husband to bring to me after the baby is born. And it was usually something that I couldn't eat during my pregnancy. So I remember the first pregnancy, I had my husband bring me a turkey sandwich. I didn't eat cold cuts during my pregnancies, and I was really craving one for some reason. And my second pregnancy, I had him bring me sushi. So things that I didn't really eat during the pregnancy that I wanted really badly, and that would be my first meal after, because you know what, I didn't want to eat hospital food, and it's okay if that's how you feel, right? And then music and anything that really makes you feel comfortable. Something obviously to wear home if you want to do a photo shoot or something in the hospital. I tended to do those like bigger photo shoots at home after I got back. But of course, you're going to take pictures. If you want to be wearing something specific, bring it with you. And
So,
for the baby, oh yeah, go ahead.
I was just going to touch on, like, for yourself. I did a lot of the things that you're saying too, and I obviously learned with each baby. But you know, taking a shower while you're at the hospital, like taking your time, because the nurses are there to take care of the baby. Like, you may not get a shower in for the next couple of days. You know, like when you get home, you may not have the time to blow dry your hair when you get home. So take advantage of that time when you're in the hospital. And then also with the snacks, I was so hungry. Like, you don't even realize how hungry you get when you start to breastfeed. And so, like, that's one of the things that I had, like, thought about with each pregnancy, and every time that I went in there was just packing just gobs of snacks. And I did the same thing. I was like, told my family exactly what I wanted for them to bring to me that I was craving that day. And you're basically eating nonstop when you start breastfeeding, because you are just so hungry. So bring those snacks in if you don't want to stick to the applesauce and graham crackers and whatever it is that they give you at the hospital. And the DVDs and music, especially if you've got a longer labor or you're being induced and you're just going to be sitting around and stuff. Like, I mean, I personally brought in, like, the Friends DVDs and just had that rolling on the TV in the background because it was something familiar. I didn't necessarily, you know, watch it, but it was just nice to have that in the background and kind of take my mind off of things sometimes. You get extremely emotional also right before you have the baby.
Yeah. Yeah, I think that's great advice. And then, you know, the baby is going to need things too. And this is sort of a really new territory for you. You're not used to necessarily packing for another little person. And so you will take lots of pictures during your hospital stay of this baby, right? So obviously the baby's going to have a million pictures taken in the first couple of days. You will also likely have a professional photographer come and offer to take pictures of your baby. You know, definitely have things that you want the baby wearing. I wouldn't go crazy. You really don't need more than 1 or 2 outfits. And one of those outfits can be the baby's going home outfit. You know, just really things that are easy to put on and off. You're really just getting used to taking things off to change a diaper and doing all those things. So keep it simple. And remember, you're going to have these pictures forever. So whatever you want them to be wearing, just put it in the bag. I think that some sort of a nursing pillow is helpful. You certainly can use the pillows that are in the hospital. You don't have to feel like you have to pack all this stuff if you're not sure. You can use a boppy. I liked the Breast Friend too. That was a good one. And they do help. The blanket and a baby cap, they will give you a cap probably at the hospital. But if you want like a softer blanket, something a little bit more cozy, then I would definitely bring one of those. Burp cloths, they also have those at the hospital, and it's totally fine to use them. It really depends on you and what your comfort level is. And some hospitals, I know we talked about this, Kim, that the hospitals still are providing pacifiers. A lot of the hospitals by us have gone what they call baby friendly. And in order to have a baby friendly certification, you can't provide pacifiers to newborns. And the idea behind the baby friendly certification is that to be breastfeeding friendly. And to be quite honest, I mean, I'm obviously very pro breastfeeding. I am a certified lactation consultant, and there are not great studies to show that pacifier use really affects breastfeeding. Bottle use, absolutely. So if it's something important to you, I mean, certainly you can deal with a few days without a pacifier if you just want to put the baby to breast every time they're fussy, which is what I would recommend. But if a pacifier is something that's important for you to have, just stick one in the bag just in case you will need it.
And to go along the lines of like new rules at hospitals, I know like going through the birth of 3 children, the whole baby cap thing has changed in the past like 10 years. Like you're supposed to keep a cap on their head and then you're not supposed to, and then you are supposed to. So what are the guidelines nowadays?
So I usually recommend keeping it on in the hospital. And then, I mean, depends on when you deliver really, but if it's really warm out and you're leaving, you don't need it. If it's wintertime, of course, you know, you want to dress your baby like you're dressed yourself. And, you know, the head is where the baby's going to lose the most heat, which is why they do keep it on in the hospital. I mean, it's nothing you need to be overly concerned about. If it comes off, I'm sure your baby will be fine. So just, you know, try to remember that these things are guidelines and they're suggestions, and not to feel anxious if something isn't exactly the way we're talking about.
And then one more question that has come in. So somebody has said, I heard you can get extremely constipated when you go into labor and after birth. What can I do to avoid that?
So in the hospital, I know that for my deliveries, they usually gave me, you know, after the fact, they would give you Colace and they would give you, you know, Tylenol and Motrin for pain control. But I think the best thing you could do to combat constipation ahead of time is to really, like, the weeks before, and really the whole pregnancy is good to do it, but I would try to eat a high fiber but high water like diet. So, you know, I eat like that in my day-to-day now. I eat a very high fiber diet. I don't eat a high carb diet, but most of my carbs are high fiber carbs. And I make sure that I'm coupling that with very large quantities of liquids, right? Because if you're eating a high fiber diet and you're not drinking enough water, you will be more constipated, right? And so that's what I would say, you know, even leading up to delivery, to just increase the fiber in your diet and then make sure you're adding extra cups of water in there as well.
So I don't know about you, but like the prenatal vitamins, me personally would, because there's so much iron in them, would make me very backed up. So I would actually take a stool softener. If it wasn't every day, it was every other day when I remembered, pretty much throughout my entire pregnancy. So that helped me stay regular. And that was, you know, the first thing that I would ask for when I got to the hospital, because I definitely battled with that problem.
Right.
On the flip side, I have another question that came in that says that I heard that moms sometimes poop while they're in labor. Can't avoid that in any way?
Unfortunately not. It was actually a big fear of mine. And I don't know why. And I think I even said to my husband, like, if it happens, I just don't want to know. But you know, the truth is when you're pushing, you might have a bowel movement. I mean, I think some of it depends on when you've eaten and what your regular GI tract cycle is like. But I think the most important thing to remember is that is such a common and normal thing. It is not dangerous for the baby in any way, shape, or form. Actually, some people think it's actually healthier for the baby. And I would not be embarrassed about it, because no one that is in the room with you, except you and maybe your spouse, has not seen it before. And so I think that is something that you just need to remember, that it is a completely normal and probably way more common than you think thing for that to occur. And so many moms go through it, and they may not even tell you if it happened to you.
I think that's good advice. All right, let's go on to taking care of yourself.
Okay, so now we have a baby, right? And we like I said before, we always remember that the baby is there, and the baby is a new exciting thing in our lives. And very often we forget to take care of ourselves, right? I think one of the most important things you could do is drink water and hydrate. I mean, they say drink to thirst, right? So you don't have to feel like just because you're nursing, you have to drink, 4 gallons of water a day. But I mean, in my day-to-day, I aim for 2 to 3 liters of fluids a day. I think that is a good benchmark. If you can drink 2 liters a day or a little bit more, that's probably where I would be. Make sure you eat. I would say coming home from the hospital the few days after, I don't even know if I ate 1 or 2 regular meals because I was just so tired and I was focused on what I was doing. And I actually really believe that is one of the things that led to my difficulty with production of milk and with my first baby. And so really try to eat, take care of yourself, listen to your body, sleep when you can. Listen, is it going to be possible for you to sleep every time the baby sleeps? I don't know, but you should at least try. You know, I'm not a great daytime sleeper, but believe me, you're going to be tired. If you're not sleeping, at least rest your head on the pillow and give it a shot. Nipple care is really important. I am going to be honest and say that nipples might be sore when I say sore, like they should not hurt and be cracked and bleeding, right? So use lanolin when you can. The latch itself should not be very painful throughout the feeding, but for the first few weeks, 2 to 3 weeks, you might have a lot of pain on the initial 30 to 60 seconds of nursing. That is normal. It's not unexpected. I actually think when moms don't describe that is the unexpected thing. So don't be alarmed if you're feeling that, but that shouldn't be what you're feeling the entire feeding. Ask for help, accept help, right? So if a friend calls you and says, we'd like to bring over dinner, sure, thank you, right? Because you are not going to want to be cooking dinner, and I don't recommend that you even try. Honestly, if you don't have enough underwear and socks to get you through a few weeks without doing laundry, place a little order on Amazon or Target and get some extra underwear and socks, because you should not be worrying about doing laundry. Anyone who wants to come visit you should be coming to visit you because they want to help you and support you, not because they want you to be waiting on them. And I think that's really important. Join a support group, join a local moms group, call me and work with me. Do whatever you think is going to help you stay calm during this time.
Talking about underwear, that's another suggestion that I would talk about is that mesh underwear that they have at the hospital. If you can get your hands on as many pairs of those as possible, take them home, because those things are amazing. Also, the really big pads, like they're like almost like Depends pads, because just with every person it's different, but you will be bleeding a lot. So I would just take home those.
Oh, and you know what they had at the hospital that I'm remembering now that was really helpful? They had pads that were like ice packs.
Yes.
So if you ask your nurses, they're usually pretty good at getting you extra stuff.
Also, if you're at the hospital and they don't offer it right up front, definitely ask them, do you have a lactation consultant around? I would really like her to come by, and try to get that one-on-one time with the in-house lactation consultant and ask, for anything and everything that they have. They may have those gel packs that they can put on your nipples right there.
Yeah, you never know.
Yeah, so you just need to use your resources. Sometimes they don't come right on out and say that. So be an advocate for yourself and ask what they can provide you.
Yes. So newborn baby care. And I think that there are a lot of things here that I'm just going to touch on briefly, but they really contribute to some of the anxiety that we feel as new parents. For example, the umbilical cord, right? I mean, nobody really loves to look at that thing. It's kind of gross. It's not something that makes your baby look cute, but it's there and it will come off usually like within 5 to 21 days, and every baby is different. And I find that has even different locations where I've practiced, I've seen different averages there. I don't know if it's like the dryness in the air or whatever it is that contributes, but leave it alone. Don't even bother touching it. If you feel like it smells weird or something is off with it, call your pediatrician, but I would really try not to worry about it.
So talking about the umbilical cord. Can you tell us some of the signs of when it starts to get infected?
Yeah, I mean, it's pretty rare for, it's not a common thing that happens, right? But you would maybe smell something funky, like that it really just doesn't smell right. But most commonly, you're going to see redness develop around the skin. To be honest, it's going to bleed a little bit when it separates. That's normal. It's going to ooze a little bit. That's normal too. So if you find like a little greenish oozing or blood on the onesie, don't be alarmed. But if you're seeing the skin around the belly button look red, that's when I would seek medical attention.
Okay.
Bathing. So I find this is actually a really common question that I get. I would not worry about bathing your baby even in the first week of life, right? They're going to give the baby a bath in the hospital. I mean, unless you've opted not to give the baby a bath in the hospital, which I have seen that too, then you might want to give the baby a bath when you get home. A bath is not immersing them in water. It's really just a washcloth with a little bit of water on it and a little bit of soap. I like to use Dove body soap, the white bar of soaps, stuff you probably already have at home. And then eventually you are going to do maybe once or twice a week a sponge bath. And then once the cord comes off, that's when you can really do a full immersion bath. I personally bathed my kids in the sink until they were too big for me to bathe them in the sink. I just felt like the height was better for me. I didn't feel like I was crouching over a tub to give them a bath. And I recommend Head and Shoulders shampoo. And that is probably the piece of advice that I give that I get the most funny looks about. But the reason I recommend that is because it really helps to reduce the amount of cradle cap that we see in babies. And what that is this really flaky, annoying kind of rash that babies get on their scalp, and starts on the scalp and then it can go behind the ears. And I've even seen it go from head to toe all over the body. And to be quite honest, the treatment for that is Head and Shoulders. And so I find that Head and Shoulders from the beginning does help to minimize that. There is a Head and Shoulders sensitive now, and you can certainly use that one. Skincare in general, babies will shed a layer of skin. Do not be worried or alarmed if you start seeing peeling skin everywhere. That's okay. It's normal. They kind of like shed their layer and there's nothing to do. No amount of lotion you're going to put on is going to prevent that. And then I would moisturize a couple times a day after that. Basically, you can use coconut oil. CeraVe is my favorite brand of lotion otherwise. And I would get the tub, not the pump, because the tub is a little bit thicker. That's what a lot of the dermatologists are also recommending by us now. And Vaseline and Aquaphor are always good things to have at home.
So the movie My Big Fat Greek Wedding, and the dad is talking about how Windex
Yes.
thing. Well, I think that Aquaphor fixes everything.
Yeah, it is really pretty great. I mean, I use Vaseline and Aquaphor interchangeably. I still don't know that I buy into the idea that Aquaphor is any better than Vaseline, but the two really are great things to have on hand.
Yes, I use them for everything. And I will say they're extremely expensive at the store, but if you go on Amazon, they are much cheaper, like almost $8 to $10 cheaper on Amazon.
Yeah. Okay, so when I do a baby prep class, one of the things that I focus on a lot is things that newborns do or have that are totally normal that every parent worries about, right? So sometimes babies can have clogged tear ducts. They worry about, should we clean out wax in the ears? Really, there's nothing to do for those things. I mean, you can wipe away gunk from the eyes. That's totally fine. But there's no medication that you need unless the eye is looking red and irritated, in which case you can see your doctor. There's no need to be alarmed about tearing, like goopy eyes, because our tear ducts are so small at that age that they're so easy to clog up. Most of the time that goes away on its own. It's not something that will ever need medical attention, but occasionally if by 9 to 12 months the baby still has clogged tear ducts, then we address it. And so that, just to give you an idea of like how long that can go on and still be normal, right? So try not to worry about it. Wax should not be cleaned, right? I know that for some parents it's a little bit hard to understand, but we don't recommend Q-tips. You can clean the outside of the ears, but do not put a Q-tip anywhere near that little hole. And vaginal discharge is normal. If you have a baby girl, it is a normal thing, even bloody vaginal discharge. And that's something I usually tell parents before they even have their baby, because if that's something that I would have seen in my babies and I didn't know, of course I would freak out. So I try to tell parents that from the beginning so they don't get too nervous. Hiccups, yes.
Not discharge, but what about the white stuff that is down there in the private area?
It's totally normal.
So do we clean it off or just leave it?
Yeah, I mean, you can clean it, but I wouldn't be rough, right? So you're going to clean everything and get in the crevices and try to clean whatever you can, but don't like rub until it comes off. If it's not coming off easily, don't worry about it.
Okay.
You know, babies can have breast development, even boys, okay? The hormones that we give them when we're breastfeeding or through delivery sometimes can cause that. There's nothing to do. Even milk production occasionally you will see, even in boys, so don't be alarmed if you see that. Babies startle a lot. Sometimes they have like weird movements of their legs. All of those kind of weird movements, most of them are normal, right? If something is happening and you're really worried, don't hesitate to call your doctor and ask them, but most likely it's nothing to worry about. Babies can be very congested. That's normal too. And of course, spitting up is something that we see all the time.
So I think I interrupted you on the hiccups and sneezing also. And I know that a lot of times moms worry, oh, you know, my baby's sneezing a lot. Should I take them in? So I don't know if you want to address that.
Yeah, I mean, so sneezing and congestion are they go hand in hand, right? Babies have very small nasal passages. They really only like to breathe through their nose. And so anything that gets in there makes them sneeze. And so we don't worry about sneezing. It's not something I would say you need to see your doctor for. It is a completely normal thing babies do.
So while we're on this subject, I think I'll ask a couple questions that came in if you're okay with that.
Sure.
So in regards to the clogged tear ducts, how often do I clean them, and do I use soap? How do we clean that portion of the body?
I would just use a warm washcloth, no soap, and really as often as it's bothering you. It's probably going to just reappear. As long as the baby's able to open their eyes and it's not bothering the baby, don't let it bother you. This is something that I say all the time. If it's not bothering your baby, don't let it bother you.
What about if their eyelids are crusted shut?
Yeah, then you can just use a warm washcloth to wipe it away.
Okay. So when do we know to call the doctor? If it's just red on their eyes?
Yeah, really if it's red on the inside. So if the baby opens their eyes and the white of their eye is red, that's something that you want to call the doctor for.
Okay. And then how do you suggest that I keep my baby from getting diaper rash and prevent any sort of rashness down there?
So the best way to prevent diaper rash is to use some sort of a barrier cream. And all of the creams that we use on the diaper area, whether it be Vaseline or, Desitin or Bomex, or, my personal favorite is called Calmoseptine. But basically all of those creams, their main function is not healing, okay? Their main function is prevention. So if you can put a thick layer of that on the diaper area to prevent the urine and the stool from irritating the skin. That's how they work. I happen to find calmoseptine to be like a miracle cream when it comes to actually treating a diaper rash too. So it's my personal favorite. If your child does not have a diaper rash and you want to just go with Aquaphor or Vaseline, that's fine. It really matters less what you use in those situations as long as you're using a lot of it.
Okay. I've actually had my own battles with diaper rash with my third child. She just has a lot of eczema and extremely sensitive skin. And we have gone through periods where she literally had cracked skin and was bleeding down there. And it's just horrible because every time they poop, then it's acidic all over, their bum, and it's just so painful. And I mean, we would just take those times and let them air dry and lay down on a bunch of towels. And every time that they would instantly go to the bathroom, instantly change it out and do air dry days to help clear it up. Now, to prevent it, I'm telling you, when I cake stuff on, I cake it on.
Yeah.
And, I love all of the creams that you talked about, but I am a true believer of that Aquaphor. And also the zinc oxide, anything with zinc oxide in it, and a high amount of it has always been helpful for my babies. Ooh, poop. All right, let's talk about poop.
Yeah, so poop is probably like a very common worry parents have. They worry about how often, they worry about what it looks like, they worry about, what if, like how it comes out. It's a very common thing. And I think that we really attribute a lot of fussiness to poop, and whether it's true or not, is really dependent on the baby. But poop comes in lots of different colors. It's all normal, okay? So brown, yellow, green, orange, pretty much any color you see out there in the fall is normal. If you see blood in the baby's poop, don't be overly alarmed. Just see your doctor, right? So the most common reason babies have blood in their poop is because they're a bit sensitive to the milk protein in breast milk or formula, right? And so there is a fix for that. That's not something that, requires an emergency visit to the hospital or anything like that. It's really something that you can wait and see your pediatrician for the next day. And that's, what I want to just convey so that you don't freak out if you see it. It's actually very, very common. And when I say blood in the poop, you're usually going to see little streaks. If you see like a lot of blood, that's a different story. Call your pediatrician. But that is a very rare thing that we don't really see a lot of. And I would just honestly remember that, baby's poop can all look very different, and just call if you have any concerns. How often your baby poops is going to vary a lot depending on how you feed them, and from baby to baby even. You may have a baby that is breastfed and pooping 17 times a day, and you may have a baby that is breastfed and pooping once in 10 days. And believe it or not, both those things are completely normal, as long as when your baby poops, the poop is soft. So, yeah. Any questions about poop?
Well, what are some signs? You mentioned the straining on here. What are some signs of straining?
I mean, I would say the most common thing I hear is that babies are making a lot of noise when they poop. And they sound like little grunts. And to be honest, it's probably not that easy to poop laying down. So I just would remind you that that's normal.
So if you see a lot of straining in the first couple of weeks of their life, do you suggest that we do anything about it?
Honestly, if the poop is soft and it's coming out, I don't usually, on a case-by-case basis, I have in the past recommended a little bit of prune juice, but it's really for situations that are more extreme.
What about Caro syrup in the bottle?
I don't usually recommend Caro syrup.
Okay.
Early on, when I was first practicing, we did recommend Caro syrup, and lately I just find it, a half ounce of prune juice goes a long way.
Okay.
All right, so how to dress your baby, right? One of the more, I guess we see it both times, like in winter and in summer, where parents are worried about making sure their baby is warm enough. And this goes back to that cap question you asked, and sort of how do you know that I'm dressing my baby warm enough? I will say it's better for your baby to be on the cooler side, maybe not those first few days, but after that, than it is for your baby to be overheated. Always feel the baby's chest, and then you can feel if the baby's chest is nice and warm, then the baby is comfortable. If the baby is sweating, take off a layer of clothing. If the baby is cool, you can add a layer of clothing. And people ask a lot what temperature to keep their home at. You can keep your home somewhere about 67, 72 degrees. It does not have to be, like super hot, and I wouldn't keep it really, really cold. Another question parents ask is about visitors. So should they have visitors come? So hospital visitors really depends on how you feel, right? If you feel like, the hospital is something that you just want to share with your spouse and you don't want anybody coming, then make that clear to people who want to come. Some people will say, I wish everybody would come in the hospital because then they don't come when I'm home. It really depends on your personality, but it is okay to have visitors, right? As long as your visitors are not sick and they wash their hands and they're respecting your needs and what you're asking them to do. You certainly can have visitors. Sometimes it's nice to pass the time, but you are not expected to entertain your visitors. Okay, so please don't. They can show themselves to a cup of coffee. They can make themselves, water, whatever they want to do. That's fine. But they really should be asking you what you need and not the other way around.
Mm-hmm.
Sleep. So it's a very hot topic. What I recommend is that you remember that babies do sleep a lot. That doesn't mean that if your baby is awake a lot, there's something wrong, right? So when we're talking about what babies do, we're talking about averages here, right? And every baby is different. Please remember that. But if your baby sleeps a lot, more than 16 hours a day, that is normal, right? Are they still going to wake up a lot to feed? Yes, but they feed and then they go back to sleep because what else are they really going to do? Sometimes they can be really fussy in between, in which case, we can talk about different strategies another time to help with that. But I do recommend that you swaddle babies' arms in. I have heard from parents that their baby, quote unquote, doesn't like that. And I usually say your baby's 3 days old and your baby doesn't know what she likes. Babies who are swaddled arms in sleep much, much better than babies who are not. And the reason for that is that startle reflex that we briefly talked about before. They startle and they wake themselves up. And so this is a much better way for them not to do that. I like the Swaddle Me Velcro swaddle. I personally think that you can get a little bit of a tighter swaddle with it. You don't want to do like too tight a swaddle, but you want them to really not be able to get out of it, right? If they get out of their swaddle, it then becomes a safety concern, and that's something that we obviously want to keep an eye out for. And I do recommend that whenever your baby is asleep, if he or she fell asleep in your arms, put them down. I would put them down sleeping flat, either in a bassinet or in a pack and play, unless we have a reason to believe that we need to do something in a different way, because it does ease the transition later to the crib. People say breastfed babies sleep less reliably than formula-fed babies. I will say in my experience, that's not always the case. I know with my second daughter, we tried. At some point, I was like, I need her to sleep better. I'm just going to give her a bottle of formula. And after a couple of nights of realizing that my daughter actually slept better when I nursed her than when I gave her a bottle of formula, we went right back to exclusive breastfeeding. So, it really depends on your situation, but it is a myth that formula-fed babies sleep much better than breastfed babies. I have seen formula-fed babies sleep through the night, and I have seen breastfed babies sleep through the night.
And sometimes I think the baby is just born a certain way. They're either going to be a really great sleeper or they may not be.
Yes, I agree. I mean, some babies are inherently good sleepers, but you can teach any baby how to sleep well.
And I'm very excited because I'm going to be using your services to help me sleep train one of my babes. So if you guys are out there and have other children or have babies, you definitely have to contact Sharon to help you with the sleep plan.
Yes.
So I do have some more questions that came in regards to sleep. One of them is it bad to allow my newborn to sleep 6 to 8 hours straight through the night?
It depends on if your newborn has gotten back to birth weight or not. So before they get back to birth weight, I usually recommend that the longest stretch be 4 hours and that there really not be more than 1 or 2 4-hour stretches. If the baby, for 2 reasons. First of all, because especially if you're nursing, because you want to establish good milk supply and good breastfeeding. And if you are letting the baby have too long in between feedings, your body will not produce as much milk, and the baby may not gain weight as reliably. And so if the baby has gone back to birth weight, then you can allow the baby to sleep as long as the baby wants to sleep. I find personally that if you wake up the baby more often for feedings during the day, then they're more likely to take that longer stretch at night.
I would agree with that. I know that we're kind of, we'll be running out of time here in about 12 minutes, and there are a lot of questions that have come in. So if you guys did not get your questions answered today, definitely feel free to email Sharon directly, email myself, join our groups, and get those questions answered. We'll keep moving on, but I just wanted to throw that out there.
Babies cry, guys. I know it's like a really heartbreaking sound to hear, but it is a common way that they communicate. So try, if you can, to not really focus so much on the crying. I always say a baby cries just like a dog barks, right? And it's not always a sign of distress. Sometimes it's just their way of communicating. Sometimes they're hungry. Sometimes they're tired. Sometimes they're feeling like they need to burp. Sometimes they have reflux. Sometimes they're not feeling well. There are so many reasons that babies cry, and I would say certainly do your best to troubleshoot a little bit, but try not to let them feel how nervous you are about it, because that only makes it a little bit worse. Mm-hmm. And certainly, the 5 S's are a very common system by Dr. Harvey Karp in The Happiest Baby on the Block, and they definitely do work. You can swaddle, you can shush your baby, you can swing your baby. There's obviously, if they want to suck on something, then you can nurse them. Baby wearing is actually a really nice way to calm babies down. That's where I would recommend the mommy wrap for baby wearing, and it really does help to keep you calm and the baby calm. I do recommend tummy time start from the beginning. I think that if you're looking to know what supplements your baby might need, you certainly should discuss this with your pediatrician, but often there's a recommendation of probiotics and vitamin D. There are many formulations of that can actually be found in the same bottle, so you're not giving 2 different things. And then try to stay as calm as you can and get the support you need. I mean, like I said, I think that is probably one of the things that is the most valuable, because we have a lot of questions when we are new parents. And I can tell you, I have a 12-year-old, and for her, I'm sort of like a new mom, right? I've never had a 12-year-old before, and I have a lot of questions about that. And it's normal, no matter how many people around you have had babies, or how many people want to give you unsolicited advice. This is your experience, and sometimes getting the help of a professional or a knowledgeable friend is really a great thing to have. I would say that as much as I think that these mom Facebook groups are helpful, they can be a little bit confusing sometimes if you get into the wrong ones. And you might find that there's so much advice there that you're not sure what is the right advice. I would say that's probably one of the common reasons moms call me, because there just is so much out there and they don't know what they can trust and what they can't trust. So,
not only that, but you get so involved in that group that you're not being there with your baby, and you're not enjoying looking at your baby's face and kissing on your baby, and you might just get so involved in all those threads that you're losing that time.
Yeah, it's so easy for that to happen, actually. So these are just a few tips on when to call your pediatrician. So if your baby's really inconsolable, if your baby has a temperature of 100.4 or higher and they are under 8 weeks of age, your doctor needs a phone call about that right away. Blood in the stool, they should be notified of. If your baby is projectile vomiting, meaning your baby is throwing up where it can hit you across the room, every single feeding, that is something you want to bring to their attention. And anytime you just feel like something's not right, right? And certainly over time, you're going to learn more about how to decipher between something that truly isn't right and just your own feelings of worry. But anytime you're concerned, it's reasonable to give them a call, and either they'll calm you down or they'll tell you to come in.
So I'll touch on that. Like, moms know best. There was an incident that my husband and I kind of got into it because our baby was sick, and I said, I think she needs to go in. And he said, well, that's going to be expensive. I don't think that needs to happen. And it was just one of those things that I went with my gut. Brought her in. She ended up being hospitalized. And in those instances, you just have to do what you feel is in your gut, So do not ignore that. That is, huge for me to give. When you say that on use your intuition, moms know best, you've got to follow that.
Yeah. It's, in general, doctors often are working through a protocol and they're doing things. They want to do what's right for your baby, but they're not always as in tune with what your baby is normally like as you are. And as a pediatrician, as a coach, I always really value parents' opinions and moms' opinions, because it's something that there doesn't have a replacement. We had a similar situation. Actually, my daughter, she was already 6 years old at the time, and I was up all night with her, and I was sure that she had like appendicitis or something, like something really wasn't right. And I never take my kids to the hospital because, thankfully I can evaluate them at home and all of that. And we took her to the hospital, and the first doctor that saw her had done an ultrasound. The ultrasound came back fine. It wasn't her appendix. And, we sat there and she just wasn't really looking like herself. And it was change of shift and a new doctor came on, and my husband said to them, like, we're not leaving unless she has a CT scan. Now, I wouldn't say always do that. That's not always. We just both happened to be physicians, and we both kind of knew what the next step was and needed to happen. But we were really speaking from a point of, this is our daughter, something is not right, and not from that, doctor perspective. And she ended up having an ovarian torsion and needing surgery that day. And so, if we had gone home, like, who knows what would have happened? She could have lost her ovary and could have made a big difference for her future status of fertility. Who knows? But when you're really feeling strongly about something, don't be quiet about it. You want to make sure that they know. Obviously, you can be nice about it, but be your own advocate and your kid's advocate.
And you guys, that's a whole nother reason why you should also maybe contact Sharon, at least get a consultation from her. Because she could be your advocate. She could be there for you and let you know when you might just be overreacting or you might actually need to go in.
Yeah.
So we have about 4 minutes for questions. I think we can leave all the breastfeeding questions out at this moment, because I think that what we can do is just do a whole nother webinar on that.
Sure.
So we'll leave those out. a lot of the questions that came in today were coping with another child. So how do I manage nap schedules with my newborn and toddler? How do I get my toddler to like our newborn baby? How do I survive baby number 4? I'm already overwhelmed with all my other kids. How do I survive the witching hour with also my toddlers and other kids? So what are some quick suggestions that you have, especially as a mom of 4, to get through those times bringing home the newborn?
Yeah, I would say that the transition for that older child is probably going to be a little bit tough, even if they don't behave in that way at first. Often they don't take it out on the baby. Often they take it out on you, which seems unfair, but that's the truth. And you might find that they are acting out, or that they are behaving in ways that are just not what they typically do. And I think that the important thing is to really try to find moments in your day where you can give your other children one-on-one personalized attention. That doesn't mean they need an hour of your time. 10 to 15 minutes often will do the trick. And then really setting up boundaries and being consistent with them. I can help with that too. I do work with parents of toddlers as well. And really just doing the best you can to show them as much love as you possibly can, so that when you can't because you're busy with a baby, then they will be more understanding.
I would definitely agree with that. Huge difference in my children if I sit down and ask them questions and actually talk to them, and not just, hey, let's look at pictures on my phone together, or let's watch this TV show together. Actually engaging with them makes a huge difference in their day.
Yeah, and I think that is, even if you're nursing all day and you feel like you don't have the time, while you're nursing, sit down and watch something with your older child and talk about it, right? Watch some Doc McStuffins and say, oh, how do you think she felt when she hurt her leg? Or, just engage them. Sometimes it doesn't have to be as active as you think it has to be. They're content just being with you.
Mm-hmm. I would agree. Well, I do want to finish this up on time so we don't keep you guys, but definitely send in those questions if they didn't get answered. And Sharon, thank you so much for being with us today.
Yeah, thanks. These have been really fun, and I'm looking forward to the next session.
Awesome. Well, you guys stay tuned. We'll be doing these monthly, and maybe in the future even more often than that. And definitely contact us if you guys have any questions. So thank you very much, Sharon.
Thank you.